So good evening, everyone, and welcome to our BioTouch Healing Health Condition Workshop on Hashimoto's disease. Hi, everybody. My name is Paul.
Good evening. This is Bev.
And to our left or right, I don't know what it is, but is Debra Schildhouse. Hi, Debra.
Hi.
Paul. Hi, Bev.
Hi, Debra. Hi.
I was just thinking the three of us 5 years ago standing on that stage doing our little dance at the book
Gala.
event. What a great time that was. So Deborah is the author, BioTouch Healing with the Power in Our Fingertips. So we are thrilled to have you here today, Deborah.
Oh, thank you. I'm always thrilled to be here with you guys. You know that.
Yes, thank you. That's great.
So our health condition workshop today is on Hashimoto's disease, and Deborah is our speaker. She's had her own personal experiences both with the problem herself and BioTouch. So if you're interested in the workbook, you can download it justtouch.com/workbook. And you can follow along at the end of Deborah's talk. We're going to teach you the sets of points to do for the particular disease. So, Deborah, we're just going to kick it right off and let you start doing your presentation. Thanks for being here.
Well, thank you for having me. So, Hashimoto Thyroiditis is the official words that you use to describe this. This is a disorder of the thyroid gland. And the thyroid gland is right here in the front of your throat. It's actually a butterfly-shaped gland. It's small, but it is mighty. I have a lot of respect for this gland, and that's because it regulates body temperature, respiration, metabolism, digestion, mood, mental outlook. In fact, it just about affects every organ in the body. So when it does malfunction, it can produce too much thyroid hormone, and that is called hyperthyroidism, or too little thyroid hormone, which is called hypothyroidism. So Dr. Hikaru Hashimoto, back in 1912, discovered new pathologies while he was studying at a surgery center in Japan. And he extracted thyroid tissue samples from patients, and then he went on to write a 30-page paper about his findings. And what he discovered was the autoimmune disorder that causes the white blood cells and the antibodies to see the thyroid gland as a foreign invader and attack it and destroy the thyroid tissue. That's exactly what is happening. You are being attacked. Your thyroid is being attacked. Hashimoto is now the #1 cause of hypothyroidism in the United States. It affects women 10 times more than men, which is often the case in many other autoimmune diseases as well. And most women are diagnosed between the ages of 30 and 50. I was 51 when I was diagnosed. My daughter was 31, and my mother was in her 70s. So many women suffer for up to 10 years before they actually get a diagnosis. And why is that? Well, it's because there are so many symptoms when it comes to Hashimoto that they're all over the place and they mimic other disorders. Now, there are 5 of what they call the typical symptoms. And those 5, interestingly enough, I never had one of them. That is how over the top this whole thing can get. Okay, so the #1 is exhaustion, where you absolutely can never feel rested no matter how much sleep you get. #2 is extremely dry, flaky skin. Number 3 is significant hair loss. And you can even lose the hair. A third of your eyebrows here at the outer corners, you can lose those. Now, I never did, but my mother did. And at the time, we didn't know what that meant when it happened to her. Number 4, always feeling cold. And number 5, inability to lose weight, no matter how hard you try, or gaining weight without changing your diet. So those are like the 5 golden symptoms, if you will, but there are so many more. So there's anxiety, nervousness, and emotional roller coaster. There's depression. There's digestive issues. Now, I actually had digestive issues when my thyroid was under attack, and I'll talk more about that later. Irregular periods and or heavy periods, infertility, joint pain and severe body aches. My mother had such terrible pains in her legs for months. She just was always in the tub trying to figure out how to help herself. And then she started falling. Well, never did I ever see that falling was a symptom. But as soon as she got on the right medication, her pain stopped and she stopped falling. Susceptibility to colds and viruses, low libido, miscarriages, trembling and increased pulse rate, breathing issues, air hunger. I had that when mine was being attacked. Yeah, that was bad. Sensitivity to cold or heat, and I am still sensitive to heat. Swelling, fullness in the throat, difficulty swallowing like you're choking. I had that also. I had some of the real good ones. Brain fog and hoarseness in your voice. So that is still not, that probably doesn't even cover all of them. But you can see why some people have a hard time getting a diagnosis, because these are just all over the board. So what are the causes of Hashimoto? Well, genetics play a very, very large role, just like they do in a lot of autoimmune diseases. So obviously in my case, my daughter has Hashimoto, I have it, and my mother had it. And my sister actually has a different autoimmune disease. She has one called Jorgen's syndrome, which is where your mucous membranes dry up. She has 2 daughters, so it'll be interesting to see as they age if they actually develop an autoimmune disease as well. Number 2, there can be environmental triggers like certain foods, pesticides, radiation, mold, or chronic stress. And number 3, hormonal changes like pregnancy and menopause. So how is Hashimoto diagnosed? So if your doctor suspects that that is what you have, you will have lab work done. And this lab work will measure your thyroid function. One of the tests is called the TSH test. That stands for thyroid stimulating hormone. And it should actually measure between 0.3 and 3.0 milliunits per liter. Sometimes they'll say 4.0. When I was diagnosed, my TSH was over 14. So it was off the charts, crazy, right? And then there's some other tests called free T4, free T3, reverse T3, and antibody tests. These are just the full thyroid panels. These are what is normally taken, and they can tell pretty well from these tests if you have Hashimoto. And so once your results are in and your doctor says, yep, you've got Hashimoto, your doctor will most likely prescribe for you a thyroid hormone medication. And it will either be a manufactured levothyroxine, which is like Synthroid, or it could be a natural hormone from desiccated pig thyroids, like Armour. And some people do better on one, some people do better on another. So sometimes you have to, just kind of see what's best for you. But most people will stay on this pill once a day for the rest of their lives. Now, when I started taking the pill, it took about 4 months for me to actually feel kind of like myself again. So you have to be patient, Now, luckily for me, the worst of my symptoms, they cleared up pretty quickly once I started taking, the medication. But again, it was a good 4 months before I thought, okay, I'm back. So, yeah. So to feel better though, along with the medication, there are some other things that you can do. And these are some great things. So the first thing I really suggest is that you become your own expert on your own condition. There is so much information now on the internet that you can read and you can get to understand what is happening in your body. And there's some very basic websites like clevelandclinic.org or mayoclinic.org, and they will start you off with some very basic information. And then from there, you could spend months and I did. I figured I'm going to know what's going on here. And it's really such a good idea to do that, because then when you start to communicate with your doctor, you can be a real team player. You can ask the right questions and you can understand the answers. And if you're like me, you want to be a team player with your doctor, and you're going to want a doctor who listens to you. That's really important, because every time you take some blood and you see what your numbers are, he could say, oh, or she could say, oh, look at your numbers, they're perfect now, see you in 6 months. But you're not feeling good. Maybe you still have some symptoms that are really bothering you. And, you don't want to be dismissed. There are other things they can do to help you through these symptoms. And one of the things that gave me the power to make sure I had the right doctor was what I was reading online, because a lot of women suffer with being kind of dismissed by their doctor. So it's very important that you educate yourself and that you find the right doctor, because they are out there. I had to find a few different ones, and then we moved twice from Tucson, and I had to find more. And I found some doctors that were not intimidated by my questions or by, what I had learned, kind of thing. So that's very important, the right doctor, and educating yourself. Lower your stress levels. That's easy to do now too, because they have such great videos, calm videos, right? Where you can do meditations, take your long walks, take your hot baths, whatever makes you feel better. Even if it's hugging a tree. And I have to say, now that I'm no longer living in the desert where I couldn't hug cactus, I'm up here on the mountain now when we have pine trees, and you know what? I hug some and it feels good. I have to say, I'm now a tree hugger. So whatever works. You want to lower your stress. Okay, improve your sleep quality. How do you do that? Well, room darkening shades, lower the temperature in your room, get a white noise machine. I have all these things going. My husband's learned to live with them. And you know what? It's important to get that good quality of sleep. The next is increase your sun exposure on your face. take off your sunglasses, don't have your sunscreen, put your face up to the sun for at least 15 minutes or so, maybe 3 times a week. And what that does is it lowers your stress and you get a good boost of vitamin D, and it boosts your immune system. And so, try to make an effort to really get that sun on you. Number 6, cut back on goitrogens. What are goitrogens? Well, they're foods that inhibit your ability to metabolize iodine, and your thyroid needs iodine. So foods like broccoli, spinach, cauliflower, kale, Brussels sprouts, those are good for, they're good vegetables for a lot of people. But if you're having symptoms or if you are newly diagnosed, you have to just stay away from those for a while. Okay, number 7, increase the foods that are really good for your thyroid. Bone broth, fermented foods like kefir, sauerkraut, and yogurt and buttermilk. These are very good for your gut health, and there is a connection between your gut health and your thyroid gland. Number 8, limit alcohol. Number 9, take selenium supplements, or I just take 2 Brazil nuts. I eat 2 Brazil nuts every day, and that gives me enough selenium. And also B vitamins are important for thyroid. And of course, I have saved the best for last. Number 10 is BioTouch. Let me just tell you, BioTouch, it has sets of points that can address every single symptom that I've been talking about. It lowers stress levels, it lowers pain levels, it makes you feel cared for. And if you're having breathing issues, guess what? There's a long set of points. There's an oxygen point. If you are having pain, if you are having metabolism problems, which you will probably be anyway with, Hashi, they have all the points for that. So there's just nothing better. I mean, that is like the whole package right there. And boy, do I wish I had known about BioTouch when I was diagnosed, but I was diagnosed 4 years before I ever discovered BioTouch. But who knows how much quicker I could have returned to feeling like myself. But what happened to me was, here it was 2005, and I'll never forget the date. It was August 28th, because you just don't forget a date like this. I had no issues, no problems. I had no symptoms. I was feeling great. Everything was going well in life. And all of a sudden, I woke up in the middle of the night, gasping for air. I felt like I was drowning. And I'm out of bed, and I was trying to be quiet. I didn't want to wake my husband. And I left the room, and I went and I put water on my face. My hands were tingling and numb. It was the strangest thing, and I couldn't get my breathing back right. It was like my rhythm was off. So okay, so I had a really weird 45 minutes, and then I thought, okay, whatever, that was weird. And I went on with my life. It happened a week and a half later again. Same thing, I was sleeping and I was like drowning, and I woke up gasping. This time my husband woke up. He's like, what's going on? I said, I don't know what's going on. And again, I'm trying to, rub my hands, and I'm trying to get my breathing back. And it took a lot longer to get my breathing. It was like my rhythm was gone. And so that was so strange. And when I started then was to like being afraid to go to sleep. I thought for sure I was going to die in my sleep, So that happened. And then real quickly, it was one thing after another. I started getting that swelling in my throat, so I couldn't easily swallow, and I felt like I was choking. I lost 22 pounds in less than 3 weeks because all I could swallow was ice water and rice and a little egg. little bit of ache. So there was that going on. And I had, like I was cold and hot and I was shaky. And I still had this like breathing problem. And I was like always like trying to get air in my lungs. And then we went to a restaurant one night and we were in the restaurant. I'll never forget it. All of a sudden, it was too noisy. There were too many people. I felt claustrophobic and I had to stand up and run out of the restaurant and run into the parking lot. And my husband's like, what is going on with you? And so, I mean, this was my thyroid gland under attack. And you can see in every way what was going on now that we know what the thyroid gland does. And so he finally said, you're going to a doctor, right? I said, okay, yeah, I'm going to the doctor. And so the doctor explained, he thought he figured out pretty quickly what it was. And he said, you were under attack, your thyroid's under attack. And so everything is going haywire. And so, got on the medication. And like I said, it took about 4 months, but at least right away, my swelling on my throat was going down. My breathing was easing for a while. Some of the worst symptoms were, and you also felt better because you know what it is. You don't think you're losing your mind. And I can see why some of these women that suffer for 10 years, that must be really, really horrible. It's not a fun thing. But the good news about Hashimoto is that it can be managed. It's now been 16 years. And the only thing that still bothers me is I am sensitive still to heat, which is a lot easier living up on the mountain than in the desert now. And the doctor had told me that my diaphragm had been weakened when I was under attack. And so when I take walks around here, and we are at almost 7,000 feet of elevation, I will huff and puff. And so I know that, that's what it is. But my mother went on, when she was on her medication, she went on to have a nice, long, healthy life. She lived to be almost 96. And my daughter, they were watching her because they knew that her mother and grandmother had Hashimoto. So they were taking her blood regularly. And when they saw that she was getting some antibodies and some things that were pointing toward that, they put her on the medication so she didn't have to suffer through any of these weird symptoms. Mm-hmm. So again, if you do have Hashimoto, it can be tough, but it can also be well managed. So thank you very much.
Whew. What a journey. Wow. I hope your kids weren't watching because you gave your age away. If you figured out at 51 was the year such and such, I'm not going to do it if you didn't listen. Then this is 2021. Okay, now, Debra, you're not 35.
I know it. Doggone it. My daughter is 44, so I can't say I'm 39 anymore.
Right.
It's a journey. It is a journey.
Yeah, that was very comprehensive presentation, Debra. Thank you so much. I mean, just really giving everybody a in-depth idea. I mean, I certainly learned a lot because, I do have a niece that has Hashimoto, and I was just ticking off some of the symptoms and some of the things that she has dealt with. So that's really very educational. Thank you so much.
So let me just get this straight. So all thyroid conditions are actually just called Hashimoto?
No. Oh. So there are regular thyroid conditions. Mm-hmm. So if there's too much of the hormone, then it's hyper. But if it's the autoimmune hyper, then it's called Graves' disease.
Right. Oh, interesting.
So if it's the hypo and it's the autoimmune, then it's called Hashimoto.
Okay.
Interesting.
Yes, okay. And so that's why Dr. Hashimoto, that's what he was working on. He knew there was a difference between the regular and the autoimmune, and he was studying the autoimmune.
Okay.
Right.
Okay. Now I got it.
But people
Yeah.
with Graves' disease, what happens to them is a lot of times they have to have their thyroid removed because it's working overtime.
Yep.
And
Right.
to stop it, they will either remove it or sometimes they shut it down with radiation. And so it's totally the opposite
Interesting.
problem.
Well, and if anybody wants to know about Debra's situation with heat, buy her book, Biotouch.
We know.
Healing with the Power in Our Fingertips. And there's a whole section in there about her heat experience and a guy named Paul Bucky.
How we had a fight. We had a fight right here at the center over the air conditioner.
Yeah.
Because I was, dying. So
I guess the message is don't mess with a woman and the heat, especially if she has Hashimoto. No.
Got it. That's serious. That's serious.
All right. Well, Debra, we appreciate it. It's been nice hanging out with you.
Yeah.
And you guys too. I
seeing you
missed you
again.
guys.
We miss you too, Debra. We're happy that you're up in the mountains, though.
Yep.
Yep.
Okay, Debra, we'll see you and stick around because we're going to teach you how to do the points now on how to work with Hashimoto's. Bye,
Thanks
Debra.
again, Debra.
Bye now.
Bye.
So you need to click yourself off, Debra.
I'm going to click off. Bye, guys.
Bye, guys.
Bye.
Whew. Wow. Okay.
Wow, that was very, yeah. What do you say?
And I'll tell you, like she said, BioTouch can address all the different symptoms. It's
amazing. I was ticking them off as she was talking about it, right? I'm like, yep, a BioTouch for that. Oh my gosh, BioTouch for that. Yep.
But we're going to give you some of the basic sets. You do these, it doesn't matter what the thyroid condition is. And we're going to go through the workbook. Again, if you want to download it, go to justtouch.com/workbook. It'll be up there for a month for all of November until our next workshop. And we're going to move right to Bev going to show us a little bit about what is BioTouch for those who've never experienced it, and then we'll teach you the few sets of points. So take it away, Bev.
Okay. So yes, and we really like to kind of just go over a couple of major bullets for everybody in case we have new people joining us, which we hope so all the time, finding BioTouch and BioTouch healing. So basically, if you do have the workbook, this page 6 is where we're going to begin. So, let's answer the question, what is BioTouch? So these two fingers, this is the tool to use BioTouch. And it's basically, the definition is one person touching another person lightly on the skin, as we say, like a butterfly. Don't you think that was interesting when she described the thyroid as a butterfly? Yeah, it's really cool. So the first two fingers very lightly on the skin. And, it just seems that the lighter that we can touch, the louder the body hears and senses that touch. So two people practicing together. This is a relationship. So let's go over these 4 major bullets. BioTouch is easy to learn. Well, yes, it is. And these, these workshops are designated to address specific conditions so that you're not overwhelmed. So this is a great way to begin to learn BioTouch. And what happens is, you begin to go, well, if I can learn those, I can learn the rest of the technique. Very easy to learn. Yes, we have had children learn BioTouch and practice it, become certified. But our main vision is to get BioTouch into the family unit so that everybody in the family can learn it. And it's very accessible, and it's easy to learn and easy to practice in that home setting. The next bullet, BioTouch is a complement to any healthcare program. Well, Debra was just talking about this very specific drug program that she's on and what to do and what not to do and diet and everything. BioTouch is not just a complement, it is integrative. It is a holistic system that addresses all parts of yourself. So the emotions will eventually come in, the mental, whatever that is, just by touching lightly on the body holds all of that for us, and it will start to resonate to that loving touch. So it's a great complement to anything that you're also using. Other modalities, special needs diet, again, any drug program that you're on, working with your doctor. This is what we always encourage you to do. So the next bullet, it has no levels of ability. This is the one, I think, a very unique gift of BioTouch. Every single one of us has the ability to learn and to practice and to be effective in helping another person with BioTouch. The very first time that you touch using BioTouch, you will be effective for another person. So that is a very unique part about BioTouch. You need no specific knowledge of the anatomy. You don't have to have any prior knowledge of any modality or anything about, a belief system or anything like that. It is just for all of us. And it's very, very, well, we're here to help give it to you. So the next bullet requires no special preparation or a belief, I just said that, or a state of mind. It doesn't matter. We're not here to address your emotional state or your mental state when you have a BioTouch session. The body, as I said before, this is the thing that holds the healing, all the possibilities. So you don't have to have a belief system. And even if you do, just touching another human being and being in their presence together, that is what BioTouch brings to all of us. So we never diagnose, we don't suggest, we just touch. And that's really basically the beauty about BioTouch. We just touch and we just let the body, it knows what to do and how to use BioTouch. So basically what we do before we have a session or we practice BioTouch with someone else, you wash your hands, and then you're using the first two fingers of the hands, you're touching lightly on the skin like a butterfly, and you're touching and holding each of the points in those sets that we're going to show you from 6 to 8 seconds. And there you go. And you're ready. Like I said, here's your tool. Okay. The second page is terms that are really designated to, especially if you're going to learn the whole technique. We use this in our trainings to just show you in which ways you touch using BioTouch. So we're going to begin with the greeting. And I can't emphasize this enough. This is the key that sets up the relationship between two people when they begin to practice BioTouch together. It helps the body unlock. And so you want to use this every time, even if you use one set, you want to do the greeting and then before you address any other part of the body. So Paul's going to take us to the video and we're going to see what the greeting set is.
The greeting is always performed at the beginning of each session. It's the only set that uses one hand and the only set that indicates which hand to use. The greeting is performed with the dominant hand. If you are right-handed, use your right hand. If you are left-handed, use your left hand. The greeting is made by touching at point 1, which is in the fleshy area just below the bottom of the breastbone or sternum. Hold this point for 6 to 8 seconds. Then with the same 2 fingers, touch point 2 on the back. To find point 2, look for the big bone at the base of the neck. From here, move 1 to 1.5 inches to the left. This is point 2. Hold this point for 6 to 8 seconds.
Okay. So the next set that we recommend, we put these workbooks together based on the condition itself and the importance of those specific sets of points. So it's interesting because the very first one, now that you've done the greeting, you're ready to do the other sets of points. So the metabolism, and if you'll remember, Debra was speaking about that. It's almost like your thyroid is under attack with Hashimoto. And if you'll notice in the picture, the diagram, the first part of the metabolism set is along the front of the throat where the thyroid is itself. So this is an amazing set of points that helps the body regulate. It helps it assimilate and eliminate. So it's just amazing. So let's go ahead and watch the video.
So just so everybody knows, this workbook that you have on each page is a link to this video that we're showing. So
Right.
If you download the workbook or you get our whole manual, each page has a link to the video that is what we're watching right now. So.
Assimilate what it needs and eliminate what it doesn't need. The metabolism set has 2 steps. Step 1 involves touching points in matching fire along the large muscles on the front of the neck. Points 1 and 1 are located above the collarbone in the soft indentations on both sides of the notch at the top of the breastbone. Points 2 and 2 are halfway up the neck on the front of the large muscles. Points 3 and 3 are at the top of the neck on the front of the large muscles. The second step involves holding a point on the front of the body and touching points next to the spine on the back. Hold point X on the front of the body is on a line directly between where the nipples would be on a youth and is 1 to 2 inches to the left of the breastbone. Another way to find X is 1/3 of the way up the breastbone from greeting point 1 and 1 to 2 inches to the left of the breastbone. The points on the back are located next to the spine, forming a rectangle around the breakover point. The breakover point is where the bottom of the rib cage joins the spine and can be found by imagining a line directly through the body from greeting point 1. To perform step 2, find hold point X on the front of the body and touch points 1 through 4 on the back. Point 1 is approximately 1 to 2 inches up from the breakover point on the left spine muscle. Point 2 is directly across from point 1 on the right spine muscle. Point 3 is 2 to 3 inches below the breakover point on the right spine muscle. Point 4 is used to address blood sugar problems and is added to the other metabolism points when needed. It is located across from point 3 on the left spine muscle.
Okay, that was the metabolism set. The next set that we recommend is the head set, and this is really great because if you remember, Debra was talking about when she was talking about some of the symptoms that depression, sleep disorders, all the hormone imbalances. The head set is a very, very important set to use for this condition. So very effective. So let's go ahead and watch the video and the headset.
The headset can be used to address conditions related to the brain. There are 4 steps in this set. In step 1, use through fire to touch points A and A. Point A on the back of the head is in the center of the neck at the base of the skull. Point A on the front of the head is at the center of the forehead, where the forehead begins to curve to the crown. Step 2 is performed in Crossfire with the fingers of each hand touching on opposite sides of the head. Hold at X, which is in the indentation beside the neck muscle at the base of the skull. It is the same as point 1 of the back set. On the opposite side of the head, touch points 1 through 5. Points 1, 2, and 3 are on the ridge line formed where the skull curves up toward the crown. Point 1 is above the outside corner of the eye on the ridge. Point 2 is above the front of the ear on the ridge. Point 3 is above the back of the ear on the ridge. To locate point 4, move down the head toward the base of the skull to a horizontal indentation approximately 1/3 of the way down from the top of the ear and 1 to 1.5 inches behind the back edge of the ear. Point 5 is opposite hold point X at the base of the skull. Point 5 now becomes the new hold point as points 1 through 5 are touched on the opposite side of the head. In Crossfire, touch point 1 above the outside corner of the eye on the ridge, point 2 above the front of the ear on the ridge, point 3 is above the back of the ear on the ridge. Point 4 is a horizontal indentation approximately 1/3 of the way down from the top of the ear and 1 to 1.5 inches behind the back edge of the ear. And point 5 is opposite hold point X at the base of the skull. Step 3 is performed in matching fire, touching points 1 and 1, 2 and 2, 3 and 3, 4 and 4, 5 and 5. Finally, in step 4, place the open palms of both hands on the head covering points 1 through 3. Be careful, don't let your hands touch each other.
Okay. So we do have something called enhancements and local work. And I was thinking when this might come in handy for, because Debra was talking about the tingling in her hands and her mom's legs, that she had so much pain. So we can use this using a combination of different points, touching, thank you, to really address a specific area. And so, this might be something that you might want to consider if somebody's having some other issues. I might add too that, my goodness, we have an oxygen point that she referred to for those gasping for air. What did she call that? Air hunger or something? It was interesting how she put that. And can I also add something? We might want to consider adding the stress set to this, because the body, boy, after all that, the body is under a great amount of anxiety and stress, isn't it?
Right.
Yeah.
Well, even just doing the headset reaches that whole stress level.
Yeah.
In that
It
the
does.
pituitary center there and stuff.
Yeah.
So.
Yep. So I guess the point is that we have everything that is required to address any condition by using BioTouch, and even things that you might come up with that we haven't put in this workbook. Again, these are just the basics that we come up with, but there's certainly anything else you can use if you want to, learn how to use those. We are here to help you with that.
And basically, all you have to do, and we won't show this video here, but all you have to do is take the 2 fingers. If you don't know anything else in this manual and you're working on a very specific condition, just take the 2 fingers and lightly touch around the affected area. Even if you don't know the abdomen sets, you could just take 2 fingers and touch around the abdomen. Maybe do what we call sweep, slow and deliberate movement across an area. Or a arthritic elbow, just touch through it, touch around it. Okay, so you can take off. The nice thing about BioTouch is you can't hurt anybody.
Yeah, yeah. We have a very specific, a teaching tool that gives you the whole technique, but you will discover that BioTouch in itself lets you just expand and experience with more and more opportunities. So like I said, we're here to help with trainings and to get this whole system of this modality to you so that you can begin to help everybody in your life.
And interesting thing that Debra talked about was 2 things that I wrote down was the whole idea of empowering people to talk with their doctors, and BioTouch does that. It empowers people. It gives them a sense in their self-awareness. BioTouch enhances people's self-awareness about their body and their relationship to their body, and then they feel confident talking to their doctor. And then when she talked about lowering stress levels was another important thing. I mean, we have the research for that. Tune in on our Monday shows, and let me see if I can show that stress chart here. No, I don't have that here. Here's the stress cycle. So if you look at our stress cycle that Dr. Stevenson did, all those things Debra talked about, some of the diet things and the genes, the DNA, the passing on the generational things. BioTouch, when you put BioTouch into that stress cycle that creates all these problems, even with the thyroid, you increase our immune system functions and our circadian rhythms, and you improve the quality of life. So, I mean, it just doesn't get any simpler and easier than that. So we have the research. We have the testimonials from people after 30 some odd years. It's worth giving it a try, and it doesn't have to cost you anything because you carry the tools with you.
All right. It's already given to us, right? It's all inherent in all of us to do BioTouch.
So check out our website, justtouch.com. Send us an email, office@justtouch.com if you have questions. If you are on this show to get CE credits, send us an email with your email address, so we can send you the evaluation form. Another great workshop, and we look forward to not next month because that'll be Thanksgiving the 4th. So we move it to the second Thursday in December, and we're going to talk about diabetes.
Oh boy.
All those blood sugar situations. That'll be a fun
What a time of the year.
Yeah, and we have a doctor coming. I don't have her name with me right now, but we will be putting out emails. Eileen has found us a nice person who that's their specialty, is dealing with blood sugar situations. So
wow, nice. That's going to be. And I just want to say, if you have really enjoyed this tonight and learning this few sets that we have introduced you to, we have virtual practitioner trainings at least once a month. Come and join us and learn the whole technique.
Okay. You just froze up there. So all right, you're back. It's perfect. So we thank you all for joining us, and we'll see you all. Well, join us Monday for Mondays with Bev and Paul. Otherwise, we'll see you for the diabetes workshop next month in December.
Great. Good evening,
thank you
everyone.
All. Good evening.
Bye.